Why wouldn't nationalizing the manufacture of pharmaceuticals, many of them, not necessarily all, but at least the ones that have been price gouged, of the pharmaceuticals and medical devices, suppose we nationalize those, and so the government manufactures it, not only manufactures, but also does research and development. So from the research and development, the R&D, on all the way through manufacture and distribution of pharmaceuticals and medical devices. Why wouldn't that hinder innovation, but in fact would likely improve and spur on innovation? It would do just the opposite of hinder innovation. It would actually help it. Why is that the case? Well, it all comes down to the fact that the executives of these like Big Pharma and medical device corporations, the executives, they're not the ones doing innovation. Instead, the ones innovating are the researchers, the engineers and scientists that are employed by the drug companies and the medical device manufacturers. They're the ones doing the innovation. And you know what? They do not, almost all of those researchers that are doing the innovation, nearly all of them give up their patent rights for what they invent in exchange for a regular paycheck. It's just how it works there. It's a trade-off, because there's many independent inventors that have gone bankrupt in trying to go through all the expense of the patent, both the patent application process and then defending the patent, and then creating all those prototypes. Then you could go through then marketing it to manufacturers, and if other companies that see if they're interested, and if they're not interested, then maybe you have to manufacture yourself at even more expense. So yeah, it's no easy task for this independent investor that doesn't have the scale of these large corporations. So it's not necessarily a bad deal for these engineers and scientists to give up their patent rights in exchange for a reliable, regular paycheck. So that's just kind of the deal at almost all of these corporations, big pharmaceuticals and medical device. I even worked at a very large medical device manufacturer. It was like a little over 20 years ago. I was just a clerical worker, just like a temp contractor type position. But part of that job, and I worked in the patent department of this medical device manufacturer as a clerical worker. And part of my job in that role was to open the mail that comes in, the department mail. And sometimes I'd open open up mail, and then sometimes it would be like this plaque. This has a brass plate on the front of it, with the name of one of the engineers that invented a new medical device, and then so that's how they got given credit. So as far as I know, they were not, but however, they did not get any royalties, so to speak, from that patent. I believe that's all they would get was the credit. The name would be on the patent, and they'd get this this plaque with a brass plate on it and their name on it, saying that they get the patent, their name on the patent as the author, and then invented the invention. So they got that credit, but that's it. But they've already given up their remunerative, or the money, the rights to the revenue from that patent. So yeah, that's how it works. So the engineers are the ones getting they're the ones doing the innovating, but they're not getting, they don't have any incentive from a financial standpoint. No, there's no special of a financial incentive to invent better, to come up with new innovations that will be this like a blockbuster, because it won't make any difference for them financially. There's no financial incentive really, other than they keep their job, maybe that, but as long as they do a decent job, and whether they get a blockbuster or not, they still get to keep their job. Generally speaking, of course. But so that when the question arises, so supposing that same engineer now works for a corporation, instead works for the government manufacturing medical devices or pharmaceuticals. How would the incentive be change? It would not change. Financially, there would be no difference because they've already given up their patent rights, and that would presumably would be the same thing if they worked for the government, in the R&D department of the research arm of the government, developing a new drug or medical device, and then if they invented a new one, maybe they get another plaque, and then that device or drug would go to the manufacturing division of the government, and the government makes it, and then they sell it at cost to the people, which would almost invariably be a much vastly lower price for the general public, who now purchases, if the patients that need it, and then then now that savings would be in the hands of the patients, who could spend it on other things into the economy, which would in turn help the economy by increasing the aggregate demand. They'd be able to spend, in other words, they'd just be able to spend their money on other things, and that would go into the economy and boost the economy, and so that money would go into local stores and shops instead of into the pockets of these big pharma corporations and their executives, so that they can have their 80-foot yachts and private islands and mansions. So yeah, that seems like that would be a good deal for the populace. This doesn't necessarily, this doesn't have to have anything to do with Marxism. I'm adamantly against Marxism. People just associate communism with necessarily being Marxist, which is not fair and not correct. Sure, that if a manufacturer is state-owned, government, sure, it's owning the means of production in that case, but it doesn't have to be. And that doesn't necessarily mean it has anything to do with Marx and Marxism. Yes. So what? Yeah, it's owned by but the reason that it is, but the important thing to note is the reason why it's being nationalized. It's not being nationalized in order to meet the goals of Marxism, which is to achieve this Hegelian cultish ideal of movement through history, which is, it doesn't make no common sense to it. So that's what the goal is, and with Marxism, you give up your individuality in order to be part of that machinery of history. But here, the goal is to nationalize in order to help the individual be able to have more economic freedom for themselves to live their lives as they see fit. So it's really, if anything, the opposite of Marxism, this idea of nationalizing and having the government manufacture and research and develop healthcare items like drugs and medical devices. So yeah, so just put aside any idea that this has anything to do with Marxist brand of communism. This is more of a libertarian brand of communism. It is nationalizing. It is collectivism for the sake of individualism. The goal is to, pooling our resources together as a collective in order to provide greater economic freedom for each and every individual, so that they don't have to pay these price gouging prices that these big pharma corporations, medical device corporations, are charging, and that makes people who, such as like type 1 diabetics, that rely on synthetic insulin. They're just really very little economic freedom for them, because they have to pay these exorbitant amounts for the synthetic insulin in order to just barely scrape by, just to stay alive. They have to just live paycheck to paycheck, with little to no economic freedom. So that this is what I'm suggesting. This is for the sake of the individual, and improving their economic freedom and their individuality, and be able to live their lives without being so tied to each and every paycheck just to survive. So yeah, and so this could also actually improve, innovation, because nationalizing is the manufacture of drugs and medical devices, because with corporations, these executives, they are legally bound to improve shareholder value, not to improve the outlook and health and well-being of the patients that use their medical devices or pharmaceuticals. But with it switched over to being publicly driven, owned and operated, from R&D to manufacture and distribution, then the goal can be made to improve the well-being of an outcome for those patients that are members of the public. And that would be then because now with we're talking about with these corporations running the show, then there's a disincentive to. There's actually often a disincentive to innovate if what the engineer comes up with, the researcher, with the scientist, if the scientist comes up with something that is great blockbuster cure, but works too good insofar as it actually, it cures a chronic disease, and but this chronic disease, say cancer, for instance, that's very lucrative, right? The current paradigm for cancer treatment, I think that the average cost of the whole treatment program is like $150,000 last time I checked. $150,000. Imagine if there was a blockbuster cure that there was innovated, the researcher came up with, that shows, oh wait, this totally cures it. It works very well. It works so well that we can forget about all those other things, all those other both medical devices and pharmaceuticals that treat cancer. This one works so well that the thing is, though, we can't even patent it. It's not patentable because it's like a common substance. And I'm just being sort of hypothetical here. Yeah, wouldn't there be a very high incentive there for the executives to say, "Whoa, our corporation could be ruined. Our shareholders would be wiped out if this were to allowed to go through the whole process of R&D up to manufacture and distribution, because like we're going to be out all this revenue, hundreds of thousands of dollars for each patient. It's going to be no more. We're gonna be wiped out. We're gonna be ruined. We can't let this happen. So we got to squelch this and not fund any more research for this this new cancer cure. Wouldn't that be the incentive? Because the corporations, executives, they are obligated to look after shareholder value, not the patient value, not the patient's health, and not the well-being of the patients or their outcome. It's all about shareholder value for these publicly traded corporations. So, but now that would be all wiped away. No more obligation to look after shareholder value if it's if the government owns and operates the R&D through manufacture of drugs and medical devices. Then you could just leave it up to the researchers and let them give them the directive to come up with the best possible treatment protocol. Best possible, what's best for the patients. That'll be their prime directive. And you have to wonder what has been suppressed. In the past, we've often heard about. Anybody who follows much of any of medical research news, there's often been through the years, over the decades, there's headlines about, this is very promising cancer treatment potential here, or this possible breakthrough, and then that's all you hear about it. So that everybody just assumes, it must have just not turned out after all, I guess. Darn, again, didn't work out. Is that necessarily the case, though? Could it actually be that the problem is that the cancer treatment just showed too much promise? So it showed so much promise that it would replace all those other lucrative cancer treatment protocols? I believe that is very, very high probability that is the case, and therefore the superior treatment was suppressed. It was just, all these corporations would have to do to say, we're just not going to fund it. Just quietly let it fade away into obscurity. These promising cancer treatment programs, then hopefully everybody forgets about them, and everybody does, pretty much. They just forget it, and everybody just assumes that the research just did not pan out. I guess that must be the case. Yeah, that everybody just assumes that's the case. Is that the case, or is it because the promising cancer treatment was too promising, was working too well, and it was going to be too devastating to the bottom line of the corporation, of the Big Pharma corporation, and they could not have that, so they stopped the funding for that research, which is extremely expensive. So why are they going to fund extremely expensive research if it's just going to take away a lot of their existing gravy train, very lucrative revenue that they already have in place from existing treatments that are inferior, but are in terms of the health outcome, but are superior in terms of bottom line financial output. So I believe that is probably what has been going on over the decades, many decades. That's what I suspect. So that's another reason why the manufacturer of medical devices and pharmaceuticals should be, I'm not saying exclusively, but to a large extent should be moved over to the public sector, where the incentive can be made, the directive will be made to have the goal of reaching the health, superior health outcomes for the patients. That should be the only bottom line, not the bottom line for some stockholders, shareholders in the stock market, or quarterly reports for a corporation. No, it should be for the patients. That's what should be the only goal. The goal for what's best for the patients, for the people, with their health. That's all it should be. That's the only goal. For from the start of research and development all the way through the manufacture and distribution. So that's how you could actually improve innovation, is by nationalizing it. It will not hinder it in the least. It will actually likely improve innovation. Because financially, it'll be just the same for the researchers who are doing the innovation. So we need to put them. But now they'll be let free of any kind of hindrances being held back because what they're researching on might not benefit the corporation financially. Now the researchers, who I'm sure most of them probably went into their careers with the goal of helping people, helping find cures. Now they'll be let free to meet that goal that they originally went into their field to begin with, to find a cure for all these horrible diseases, and see what's try to find what's the best for what's going to help. They want to help humanity, and they'll be allowed to do that if we were to nationalize the manufacture and research and development and distribution of pharmaceuticals and medical devices. So that's what I think we should do. So yeah, I guess that's all I have to say for now. If you're still watching and listening, thanks for watching.